All right, good afternoon, everyone. I have that it's 1 o'clock, so we are going to go ahead and get started. Today's Lunch and Learn is going to be on dental assisting. So I'm very excited to have with us Sherry Shook, who is with our dental assisting program. And she's going to be talking to us today. Just a couple of housekeeping things. We will be recording this session, and it is streaming live on our social media accounts. If you have any questions, please put them in the chat box, and we will respond to them once Sherry is finished presenting. So Sherry, at this time, you can go ahead and get started.
All right, thank you very much. And I'm glad that everybody tuned in today to hear about our dental assisting program. It's a new program here at Davidson-Davie Community College. And we're hoping, it's been a long time coming, and we're hoping that things are lined up now that we could possibly start this fall. So we are in the process of being accredited by the American Dental Association, and we're at their mercy over COVID. We've been delayed 3 times. So we just 2 weeks ago finally got a site visit where they come on our campus, but this was a virtual site visit. So they came and reviewed all of our documents. We spent the entire day and part of another day just being under the gun, examining. They were examining all of our documents. So we hope to hear something back from them sometime in July, and then can actually take down the accreditation pending off of our website and start enrolling students. So I'm glad you tuned in, and I hope that you learned something from this, and please feel free to ask me any questions if you would like. So I'm going to go to the first screen. And we are commissioned by the American Dental Association Commission on Dental Accreditation. So you might see that on our website also. To the right, we have a fully functioning dental clinic that we will practice on mannequins, not really patients. So not right now. The students practice on each other after they practice on the mannequin and meet competencies on the mannequins. So you can see in the picture on the right that there's a dental chairs. We have an assistant's chair, a dental assisting chair, and an operator's chair to the left of the patient chair. And in the background, you can see we have our computer screens. We have dental software, just like you would see in a dental office, and students will learn how to utilize those. Our mannequin that you see here, these mannequins are fully functioning. They have 32 teeth, and they're plastic teeth, but we will use them and do fillings on them. The students will learn how to wash, dry, irrigate, suction, perform all different kinds of procedures on these dental mannequins. So we have 6 of these. We have 6 operatories in our dental assisting clinic. And each operatory is basically a chair, or as if you went to the dentist and went into a room and sat down, that's called an operatory. So we're excited to have this and bring this to you. And hopefully before long, we'll be able to open it up for people to come in and visit me in my office, and I can take you on a tour. But right now we're still in the pending accreditation mode. Here on the left, you can see we have our classroom space, and then we also have dental laboratory space. So this is a huge classroom that's been renovated, and we have 2 separate areas within one area. We have plenty of locker space for students. We plan to take 12 students in the fall, if pending accreditation, of course. 12 students, so we provide lockers for our students because when you go out on rotations, you will be going on rotations in the second semester, and you have to keep shoes separate that you wear in clinic separate. So we have lockers for you to keep those there in our facility so that you can access those when you need them. If you come, some courses you will be in the mornings, you might be one place and in another. So just to accommodate all the needs that we have for the students. You notice in the background, in the picture on the left, is a smart board. We also have one in the foreground that's not in this picture, but each side of the room has a smart board that we can access. The further part is where the fun begins in the dental materials lab, where we make models of teeth. You learn how to mix all different kinds of materials. Usually in there, we get dirty with plaster and stone. So we will have gowns for you, but we play loud music. Everybody sort of works on their own pace there. It's a really fun time to learn a lot of information about mixing, storing, manipulating all kinds of dental materials that are used in the dental practice. To the right, you see some tubs. All these tubs are filled with instruments that all the students will learn, instruments that are particular to all the different dental procedures, dental specialties. Most people are familiar with orthodontics because, you know, a lot of people have orthodontics or know somebody who has had orthodontics. We also have endodontics, which are root canals, but we also assist in those, but most people don't know that as well. But orthodontics is what most of the students come into knowing a little something about because they've experienced it. But in each one of these tubs, we have each of the specialties for whatever we would be doing on ortho. We would have all the different instruments for orthodontics. We would have all the wires. We would have all the rubber bands and the waxes and things like that, that we can just take one out when we're studying it and have everything in it. I'll have inside each one too a key that has the instruments. So if you need to do some on your own and learn on your own, we'll have all that for you, and it'll be self-sufficient. So you can grab a chair in the classroom, grab a box and study and learn all you need to do. This is our lab space. Here are just some more examples of things that we're going to learn. It's sort of overwhelming with the first day, and I'm glad I get this opportunity ahead of time, especially since we're going to be cutting it so close to when we plan to start. But on the left, you see an operative kit that would be, we would use this for a filling on a patient. So you have to be able, students will learn to what they need out, what they need to prepare ahead of time, what they need to mix, and how they need to mix whatever it is we're doing on the procedure. But we would set this up depending on if the patient was having a white filling or a silver filling or a sealant, things like that. On the right is, hopefully you can see that, a picture of a student using a mirror inside a patient's mouth. So you will learn, that's called indirect vision. You're looking at the back side of the teeth without turning your head all kinds of ways to be able to access it or visualize it. So we use mirrors for indirect vision, and we teach you how to use all the instruments in the mouth, the proper way to hold the instruments. If you need to retract or hold back a tongue or a cheek, the proper way to do that without injuring the patient or yourself. We talk a lot about ergonomics and how to position yourself, how to use your hands and your arms in the best way so that you don't put too much stress on yourself or on the patient. So you do get in the mouth. We have that question a lot when we first start. Do I actually have to put my hands in people's mouths? Yes, you do. Luckily, they're gloved, so we'll learn all about that also. But yes, you do have a lot to do in the patient's mouth. You don't just sit beside the doctor, but there's a lot of things that dental assistants will do, and I'll talk about that, where you actually sit in the chair as the operator and perform several different types of procedures on a patient. Here on the left, you can see a dental assistant with radiographs. We have a radiographic program that you will gain a certificate, and you'll be certified to take radiographs on patients. This student actually is working on mounting x-rays. This is called a full mouth series. Occasionally, you have to have a full mouth series, usually when you're older, not when you're young. But most people just get the ones on the side of their mouth, 2 or 1 on each side. They're called bite wings, and they just sort of show the crowns of the teeth. And they're mostly looking for cavities, things like that, that you would have every year when you go to the dentist. What you're looking at with this student is a full mouth series, which is sort of like, I tell students, it's like taking a group picture, but individual students. So there's 18 films in a full mouth series, and students will learn that you have to know exact placement. You have to know how to get a parallel. We talk a lot about parallel and vertical angulation and perpendicular. You do have to use math, believe it or not, in dental assisting, but you have to know exactly how to line up the tube head in order to get the film so that you can, or the image, so that you can see what you need to see as the doctor has prescribed. You couldn't just take this, since you'll be certified, you couldn't just go somewhere and take x-rays on a patient. You would have to have a prescription from the dentist. So the dentist in North Carolina has to prescribe the radiographs, and you as a radiographer are the one that's trained to complete that. But we want to make sure that you can complete it so that it's satisfactory and diagnostically acceptable. So when you go in to the dentist, when they take those x-rays on you yearly or every other year, you want to make sure that when they take them, they are exposing you to radiation, that they're taking them so that you don't have too much radiation exposure. So you want to get it right the first time. So that's what we'll train you to do. On the right-hand side, these are just a lot of surgical instruments, and these are another bunch of instruments you need to learn. Each one has their own specific function. So you will learn what the instrument is, what its function is, and each individual tooth that it is functioning on. One does not service every single tooth. So a lot to learn with all these instruments. Each has a purpose, and you'll learn that purpose. And on the left-hand side, you'll see a lot of teeth. Each adult has the potential to have 32 teeth. Some have extra, some have less. And what you do in our program also is you learn every tooth and every single surface on the tooth. When you run your tongue on your tooth, you can feel the tops, the sides. You can't feel the roots, hopefully. They're under the tissue. But you'll learn what roots are called. Some of the teeth you can see on this screen have more than one root, but each root has a different name. So you'll learn that, but each surface. So a lot to learn on that. We do charting. The pet students will go into a patient's mouth when they go out in offices, or possibly in a mannequin, and look and see if there's fillings. And you'll know you have to chart all these fillings or sealants, restorations, missing teeth, all that. So each filling has a different symbol that represents what it is. If it's a white filling, if it's a silver filling, if it's a sealant, if it's a missing tooth, if it's a crown, all these have different symbols. So you learn all these symbols and learn how to put them on the correct tooth and the correct surface or area of that tooth. So when the patient leaves, you have a chart that tells you what the patient's mouth looks like that you can look at, and you can send it to the doctor. So the doctor, if he does a treatment plan or something, they have the exact duplicate of whatever was in the patient's mouth. So it's a lot of responsibility on the dental assistant, but we practice because we have a ton of stuff to learn. And then on the right-hand side, most people would know, hopefully, what that is, a pair of gloves, especially with COVID. Dental has always worn gloves. Well, back when I started originally, I'm not even going to tell you how long ago that was, but I actually started when we didn't wear gloves. But then AIDS really changed all that in the dental community and the medical community. But the PPE that we wear in dental is very restricted and mandated. So that's the first thing we learn as you come into the program are the protocols for disinfecting, cleaning, sterilization, and the PPE that's required for each of those processes. So a lot of that, hopefully, hand washing, things like that, we've all gotten used to over the last year. All right. Dental assisting in North Carolina is guided by the Dental Practice Act in the state. For dental assisting in North Carolina, we have Dental Assistant 1, Dental Assistant 2, and CDA or Certified Dental Assistant. So in the United States, each state has a different regulation for dental assisting. So if you move to another state after you maybe have completed at Davidson-Davie in North Carolina, and you move to another state, you need to consult that state's Dental Practice Act to make sure you have all needed to qualify to practice in that state. Luckily, at Davidson-Davie, we are seeking accreditation, and that tends to lend each state's regulations. More than likely, you will be eligible to practice in that state because you will be graduating from an accredited institution. A dental assistant 1 in North Carolina cannot be a CDA right away, but a dental assistant 2 that's graduated from an accredited program can and is eligible to take the dental assisting national boards, which would make them a certified dental assistant. And a certified dental assistant is a national board. You don't have to do a state by state board in North Carolina. Okay. So also in North Carolina, we have dental hygienists and then the dentist who delegate the functions. A dental hygienist or a dental assistant in North Carolina can't really do any kind of practice unless a dentist delegates the functions. So that just means they have to be there to tell you, I need this, you can work on this patient, but they have to oversee that. A dental assistant in North Carolina does not have a license, okay? You have just the different regulations for the type of dental assisting in North Carolina. So if you have any questions about that, you can go to the North Carolina Dental Board and look at their Dental Practice Act, and you can see the difference in what a dental assistant and a dental hygienist does also. A little bit more about that coming up. So again, in North Carolina, you are under the direct control and supervision of a licensed dentist. So what you do in the office falls under the provisions of the dentist license. Okay, so you're not licensed in North Carolina. Some states have registered dental assistants, which they may accept the certified dental assisting national credential, but they might also require you to get the registration in their state. I think California, Pennsylvania, some of those states do that. But if you have any questions after you finish, usually after the students go through the programs, we sort of know what state they're going to be in if they're moving out of state, and then I'll get together with them and we'll look up the regulations and help them figure out. So in just a brief overview here of Dental Assistant 1 and Dental Assistant 2. A Dental Assistant 1 does not qualify by training and experience for classification as a DA2. A DA1 basically is an office-trained dental assistant or a dental assistant who has completed, maybe you've probably seen some of the programs that are 10, 12-week programs that are, we call them proprietary schools, but they're training schools. So when you come from those, you may learn, they can teach you radiology if they're qualified to do that by the state. Not all are, but you can learn some of the things that a dental assistant 2 does, but you would have to qualify and meet their credentials. So I like to tell students who want to go to some of the Dental Assistant 1 schools, check them out really well to see if you're paying to go to a school where you might can learn all that on the job and be on the job trained. There are, I'll talk about that a little bit more too, about what happens if you're on the job trained. can you become a dental assistant 2 or a certified dental assistant? So a dental assistant 2, one route to be a dental assistant 2 is to enroll in a program that has been accredited by the ADA. And you also have to have a current certification in CPR, the healthcare provider level or American Heart Association level. If you have any questions about that, feel free to contact me. They do provide those courses here at Davidson at a great fee, but it's the correct one that you can be certified. So the first thing we'll do with our accepted students is make sure that they've got their current certification in CPR. Another way to become a dental assistant 2 in North Carolina is if you have completed at least 1 year in a dental hygiene program that's approved or accredited by the American Dental Association, and you have your CPR, you're technically classified as a dental assistant 2. Dental hygiene programs and dental assisting programs do share some of the same courses. So those courses would have been completed the first year in a hygiene program, but dental hygienists don't get the in-depth knowledge and skill sets that we teach as dental assisting. In dental assisting, that you would have to do chairside. So it really is a hindrance. And I have known some hygienists or some people who might go to hygiene school and then drop out, or for whatever reason, life gets in the way or whatever. And they do go and can learn on the job some of the stuff that they could have learned in a dental assisting program. So you can, that is another route for people to go also. Or a dental assistant 1 can be employed as a chairside dental assistant under a licensed dentist. If you have been employed for 2 consecutive years out of 5 years, then, which basically works out to about 3,000 hours, you can also get additional training. I'll talk about that too, but you can petition to take the D&B, the Dental Assisting National Boards, and or get qualified other ways with additional training. So if you've worked for a dentist for 5 years and 2 consecutive, it just doesn't mean part-time, but 3,000 hours basically, you can go from a dental assistant 1 to a dental assistant 2 in North Carolina. If you do that, you also have to take a 3-hour course in sterilization and infection control, which are usually offered through AHEC or D&B, Dental Assisting National Board. They do offer some of those courses, and they're readily available if you Google those. You also take a 3-hour course in dental emergencies, and then you also have to take the radiology course. And some of the AHEC, Area Health Education Centers here in North Carolina, offer these training courses for people who want to become a DA2. And you can contact your AHEC area. There's one in Greensboro, I know there's one in Winston, and see about that if you meet all the other criteria. And then, of course, you have to have your CPR. So you see, there's a lot more to it than just being on the job trained. If you are on the job trained and want to see about becoming a DA2, also feel free to contact me at the school. I'd be glad to talk to you about that also. The best way, though, is to go ahead and go through an accredited program, and then all these other things that we're talking about, that what ifs and all that, are all satisfied by the completion of an accredited program. Once you're a dental assistant 2 and you have successfully completed the program, or one way or the other become a DA2, you can petition to take the national certification boards. And we are going to hopefully incorporate those into our program. So hopefully by the time you get out, you've complete the program, you could already be certified in infection control and radiology. And then after you've completed the whole program, you can petition to take the comprehensive, the rest of it, the general chairside part. There's 3 different parts to the exam. So there's several different ways you can talk about it, and the options are, one's more expensive than the other, but if you finish, like say, for example, the infection control course, you know, personally, I think it's better if you take it right afterwards because it's all fresh on your mind, or the radiology. But it is more expensive to take it that way. But I'm hoping that we're going to try to work that into our courses so that we can offer an incentive for you to take it like that. So that's still being in the works, but that's just a little tease about that. So the goal is to become a certified dental assistant. Even though in North Carolina, it's not a requirement to be a certified dental assistant, but it does show that the student has gone the extra mile to maintain, you know, the credentials they need, and to go ahead and seek further out of school to be a CDA. And a lot of times the CDA credential does get you in the door if there's 2 or 3 people applying for one position. That does put you more at the top of the list than the other. So we'll talk a lot about that as we get into the program. And I'm talking a lot. In North Carolina, there are permitted functions for DA1 and DA2. And this is just some of the things that you'll see if you go to the dental board website and go to North Carolina Dental Board, and then go to dental assisting, and you'll see all the different things that you can do. A dental assistant 1 mostly is doing some of the laboratory procedures that you don't have to be certified in to do. A lot of people tend to start at the front desk, or appointment management, things like that. You can do topical anesthetics and some fluorides that don't require a competency before that, but there are some things that you do have to be, you know, have competencies in to learn how to do that. Dental assistant 1, again, under the direct supervision of a dentist, we take impressions. So if you went to the orthodontist and you had impressions, that was probably a dental assistant 2 that did that. You make models. So I remember, most people can remember having their models made, and you look the before and the after, before your orthodontics and then after your orthodontics. So you create those models, and we'll learn how to create those to all the little specifics to make them look exactly as they're supposed to look. So these are just a couple, and I do have a few more that we can talk about also.
Sherry, I just want to let you know we have about 3 or 4 minutes left.
Oh gosh. Okay.
So
I'm just going to go through these pictures then. Does anybody have a question or anything?
We haven't had any questions yet. So
okay.
We'll still catch those at the end though.
Okay. This is just a picture of some impressions that everybody probably has had or has dreaded having. But you learn to mix at the appropriate amounts, and you have to measure and all that. So the math comes in again. Students don't like it, but we have math. We do sealants. You'll be certified in sealants. You'll be certified in coronal polishing when we finish the program. You'll be certified in radiology, and also in nitrous oxide monitoring, not administer. You can't give, but you can monitor the patient. So we'll talk about that. We don't do IV sedation in our program, but a lot of times if you go to the oral surgeon's office, they will teach or send you to a course for IV sedation, but you will be monitoring nitrous oxide, or laughing gas, as some people say. And these are just some more of the things that you might learn while we're practicing in the dental on each other or on the mannequins. So I just have pictures left. And we do use a handpieces, not in the patient's mouth for a high-speed handpiece, but we do in the lab. We have a lot of different things to use in the lab. I think that's about it. So one last thing, most people know what bleaching trays are. This is what we make, a bleaching tray. You will take impressions. You will fabricate bleaching trays for patients or possibly yourself. So we teach you how to do that also. All right.
Perfect. Thank you so much. At this time, if anyone has any questions, you are free to unmute and ask, or you can put it in the chat box. We have just another couple minutes that we could take a question or two. So please feel free to do so. And if no one has any questions, we will go ahead and end this lunch and learn. Sherry and I will hang around for just a little bit, just in case you do have a question. We'll be here for a few more minutes. Otherwise, thank you so much for joining today. And Sherry, we just want to thank you and appreciate all the knowledge that you shared with us, because I learned a whole lot today.
Well,
I
good. I'm
don't
glad.
work in anyone's mouth, but I'm thankful for people that do. So
There's a lot that
appreciate
goes
it.
into it. Well, thank you. I enjoyed it. Thank you for having me.